Hamstring injuries, what you need to know. Hello, David Fitzgerald here from Dublin Physiotherapy Clinic. Today is another video in our series on hamstring injuries, and I'd like to look at a bit more detail at the type of issues we as physiotherapists need to look at in terms of trying to understand how hamstring injuries occur. We've given a lot of detail about the types of injuries and where they occur and how they influence the rehabilitation process. But when we're looking for more detailed information about why the injury has occurred in the first place, we need to examine other areas around the hamstring and other regions that are involved in the function of the hamstring muscles, so that we can identify if there are faults in those areas, and then obviously to put corrective exercises in place. So I'm going to share a bit of that detail with you now. So this is a picture of the hamstrings, which you can see here. And the hamstrings are remind you again, the three long muscles that run down the back of the leg. They insert into the base of the buttock and attach behind the knee. But as you can see from the anatomy here, although the hamstring muscles operate on the hip because they attach behind the hip joint, so they can extend the hip, so that's movement is called hip extension. They are not the prime hip extensor muscles. The main muscles which extend the hip are the glute maximus, a large big muscle that forms the contour of your buttock. And one of the common problems we see with hamstring strain is that the hamstring muscle is trying to compensate for weak gluteal muscles. So instead of the gluteal muscles being the main hip joint extensors, the hamstring muscles are working to try and extend the hip as well as to flex the knee, which is their main job in life. So we as physiotherapists need to utilize tests which assess the capacity of the gluteus maximus to act as a hip extensor muscle. There are some specific tests, but one of my favorite tests for that is to get somebody down into a crouched position with one leg back behind them as if they were on a racing bike, and then to try to lift the trailing leg up with the knee bent. And that's a position which really forces strong work in the gluteus maximus. And if there's any weakness there, that kind of a test will really expose it. Sometimes we'll see people getting cramps in the hamstring when they try and do that movement, and that's a real telltale sign that the hamstring is still trying to do the work of the gluteus maximus. So that tells us from a rehabilitation point of view that we need to put work into progressively strengthening the gluteus maximus. Another reason why the gluteus maximus may not work well to extend the hip is that the hip flexors on the front of the hip can be tight. So if those muscles are tight, the ability to extend the hip is compromised because it's just stiff. So when you test for that, you find restriction of the hip flexor muscles, and they're an important component that you have to target with specific stretches in order to give you the flexibility. But that's a simple test to do. The other reason we often see contributing to hamstring strains is when the core musculature isn't working sufficiently. And because the whole of the torso is balanced on the pelvis, and the pelvis is balanced on the two femoral heads, if the trunk control which supports the body on the pelvis isn't working well, the hamstring muscles on the back and the quadriceps muscles on the front can try to balance the pelvis on the femoral heads. And although that's not very efficient, it is a compensatory muscle response that occurs in the presence of a weak core. And the weak core meaning the muscles above the pelvic ring, the abdominal wall, the spinal muscles, and the gluteal muscles. They're the prime muscles involved in stabilizing the core. So if there are discrepancies there, or what we would call an imbalance, if other parts of the torso and legs are too strong relative to a weaker core, then you get a situation where the hamstring muscles are asked to do more activity, and that increase in load then can leave them vulnerable to a strain. If another scenario we often see around the side of the hip, so the buttock muscles that we see here. Underneath the glute maximus, we've got two other gluteal muscles, the glute med and min, as they're known. And if those muscles aren't functioning well, they destabilize the pelvis in a lateral plane. And again, the hamstring muscles can be called in to assist in trying to stabilize there, although they're not mechanically efficient in terms of doing that. The other problem you see when the lateral hip musculature is weak is that it tends to make the leg buckle when it's under load, so the knee tends to roll inwards when the leg is loaded, and that's usually because the lateral hip muscles aren't able to stop rotation, and that's another source of putting rotational pressure on a hamstring, and that can sometimes trigger a deficit there. If we look further down, away from the buttock and the hamstring, down into the foot, if people have a flat foot scenario, what's known as pronation, that flatness of the foot can make the whole lower limb turn in. And in general, that's an indication that the weight-bearing capacity of the limb isn't good. And in that situation, it's really a bit of a lottery as to where the pressure ends up. But sometimes one has to use orthotics or inserts into a shoe to try to stabilize a flat foot, because the rotational or lack of rotational control around the limb puts other muscles in the firing line. And that's a situation that you have to address, particularly if you've tried to address weakness in other areas of the muscles along the lower limb and trunk and core, but you don't get a lasting effect because other mechanical factors are feeding into putting pressure on this area. So as clinicians, we have to identify those characteristics. There can be imbalances between the front and the back of the leg. Sometimes if the quadriceps muscles on the front of the leg are inhibited or weak, the hamstring muscles at the back try to compensate to help to stabilize the knee. And that's a complex mechanism of how that happens, but we do need to identify that, because it's just the body's attempt to try to stabilize around the knee to give some sort of stability. But again, that's not it's not their prime function. But as clinicians, we always do have to test for quadriceps function to see is there good what's called co-contraction, because the way the knee is stabilized is by the muscles on the front, the quadriceps, and the hamstrings at the back, both working in unison to stabilize the knee. So as you can see, there are a lot of different aspects involved in trying to understand why a hamstring has got pressurized. So although in the initial phases our priority is to reduce the pain and to try and control symptoms, but if we're looking for underlying causes, we do have to spread the net quite wide, and there are a whole host of different tests that we need to look at to determine is there any deficits in those areas. So I hope you found that information helpful. If you haven't subscribed to our channel, please feel free to do so. We generally produce weekly videos on various topics, so please feel free to subscribe. If you have any comments, enter them in the comments below, and we'll do our best to respond to them. I'll see you again on another video. Bye for now.